Hey everyone. Alright, so we have another safety training for today. It's on oxygen usage. Um, a lot of this is really for staff, um, but it's important for you to know too. Um, Mostly because, oh, by the way, go Jazz. Um, but mostly because, we do have individuals that we work with that are our friends that have use inhalers, they have asthma, things like that, and it's very important. Pardon me. It's very important for us to, know how to help them if they're really having trouble breathing. Once we see that, we need to know the signs and we need to know what to do to make sure they stay safe. So let's get started. So we'll go over the first page, which is something that staff we have to make sure that we know of, and as long as we know, we can kind of show or help out, and we need to help out in any situation that may arise. But, it's very important. Oxygen is very important for the brain. It's important for organ function. If you don't have enough oxygen getting into your system, things that aren't what you want to happen may happen. And so we want to make sure that we're taking care of each and every one, at program. And if ever you had trouble breathing, it could happen. Sometimes hyperventilation, things like that happen if people get anxious, or and anxiety is an issue in the United States. And there's been a lot of people, as well as sports players, that have actually said, I have anxiety attacks, and they've actually left games and things like that, and they've gone and gotten oxygen to kind of get them back to, that's why they say breathe into a bag, but at the same time, if you actually have oxygen, it helps rejuvenate the system and brings down that anxiety quite a bit. So, this is oxygen usage. So I'm just going to read off the first part. If the brain, heart, lungs, and central nervous system, or CNS, are denied oxygen for even a few minutes, this can have lasting damaging effects on them, and hence the person involved. A person could possibly suffer brain damage or heart attack, lapse into a coma, even experience permanent damage to the lungs. Oxygen, when administered quickly, can be stabilizing and life-saving. It is therefore important to recognize those times when administering oxygen is vital for the health of an individual in medical distress. If in doubt on whether oxygen should be used or not in a given situation, be assured you will do no harm to an individual in distress if oxygen is administered for a short period of time. So basically that says, if you're like, I'm not sure, does this person need oxygen? Do they not need oxygen? If they get a little extra oxygen for a little bit of time, it's not going to hurt them. It's kind of the same thing as with water, well, again, depending on the type of heat distress. But, a little bit of water or a little bit of oxygen should always do very well. And this is saying specifically, for oxygen, that if you give somebody a mask, if they're breathing strangely, if they seem out of it, then a little bit of oxygen won't hurt. And here are some instances when oxygen should be administered. When a person is having difficulty breathing due to a medical condition such as asthma, chronic bronchitis, or COPD. Number 2, to prevent a person from going into shock. 3, when a person is in shock. 4, when it is suspected a person has experienced a heart attack or a myocardial infarction. And somebody will let you know, and you'll kind of know them. And if they're holding their chest very tight, you know, and they're saying, "I don't know what this is," and they want to just lie down, then it might be it's oxygen would be very good at that time. Number 5, when someone is having difficulty breathing due to chemical exposure, a chemical release into the environment. I've actually seen this at places that I've worked before, where people work around too many chemicals and they become nauseous and they even pass out. And oxygen is used to revive them or kind of get them back to a stable. But this was a long time ago when I was a kid, because now they have a lot more safety regulations to make sure that they still have oxygen on hand, but that people are wearing masks in certain areas, to make sure that they don't get sick. And number 6, when CPR has been administered for an extended period of time and the victim would benefit from a higher concentration of oxygen than is supplied through rescue breathing. So again, if somebody's really like passing, and you need to let somebody know. If you don't have a first aid or CPR license or card, you need to let somebody know that does. Do your best to help them, but if you haven't taken the class, you don't want to make the situation worse. Each staff, we have that. We know how to do compressions. You can always take the class. I think Lucy has her CPR card, and it's a good thing to have. It's a good thing to know. And first aid is also a very good thing to have. But CPR, if you save somebody's life, you can. And so, but oxygen at that time, when you rescue breathe, and you always put a mask over the person's mouth. So you're breathing in, and you don't want to take in anything that they have. But I don't want to go over the whole CPR aspect of everything, because that would take a long time. But if you have oxygen on site and you can get it, so that it's kind of helping them breathe, and then you continue with like chest compressions, or staff continues with that, it can really help them. It keeps the oxygen into the brain, and like they said, in the lungs and everything, and you don't want anybody to lapse into a coma or even possibly die. So again, it's always important for you to see the symptoms and know the symptoms, and then also to get a staff whenever this is happening. Because like I said, we all have our CPR and first aid card. So a shortness of breath or difficulty breathing can be due to a variety of causes. So asthma, so some people have asthma, and sometimes it's painful what they go through when they can't really breathe. It's really a kind of a painful situation. Choking, bronchitis, injury, heart attack, allergic reaction. So all these things, could cause difficulty in breathing. People are finding it difficult to breathe due to any of these conditions are in respiratory distress, a medical emergency. So respiratory distress requires a 911 call to request assistance from EMTs, emergency medical technicians. Before EMTs arrive, however, staff can assist the person in distress by administering oxygen and helping the individual breathe more easily until the EMTs arrive. And that is our job. When you have your first aid and CPR license, you do the job until somebody with a higher standard of helping people gets there. Once they're there, they take over, and you step out and let them do their job. A person experiencing difficulty breathing might exhibit the following signs and symptoms. Breathing rate that is either too fast or too slow. Noisy breathing, including wheezing. Making a whistly sound, gurgling. You'd hear that from the throat. Sitting upright with hands on knees. Bending the torso slightly forward, i.e. in the tripod position. So tripod just means 3. And, they're kind of bent over like this and holding their hands on the ground. They're in a tripod position. Using shoulder and back muscles to assist with breathing. They're trying to really open up the airway is what they're doing. When somebody starts like, I'm not getting enough air, then, you sit up and you try to get as much air as possible. If someone's having difficulty speaking, using only single words or short sentences, which usually it's like, I don't know, something's wrong, and you move on from there. Being ashen in color, pale blue skin, lips or fingernail beds, that's a sure sign that somebody is, if things are kind of blue and then people get pale, kind of, whiter than normal for them, and they're also exhibiting these other signs that we've gone over. Well, blue means they're not getting air, and so it's good to know, that they need oxygen right now, especially when we're on site. But we'll go over that in just a little bit. For individuals with asthma who are experiencing difficulty breathing, direct the person to use his or her inhaler, and if needed, assist the individual. So if they're having a tough time breathing and it doesn't seem like they're actually using the inhaler correctly, maybe help them. And you'll notice the difference. Sometimes somebody just thinks they're having a little bit, and so they take one. But if somebody's having a full-on asthma attack, then they might need assistance. If the person does not have an inhaler, oxygen should be administered immediately. And also 911 should be called, in my opinion. If you suspect someone is choking, clear the airway prior to administering oxygen. Again, this is for staff to do because you need your CPR card. Clearing the airway basically just means checking all the way at the back of the mouth and the throat if something's there. Don't do this, though. Let the staff member do it because we've been trained to do it. Shock could be caused from a number of situations. So fluid or blood loss, heart attack, allergic reaction, bloodstream infection, or spinal injury. Recognizing the symptoms indicating a person is going into shock will allow quick response and prevent serious organ damage. Let's see, signs that someone might be going to shock include restlessness. They keep moving around and they, because it's kind of a state of fear. So they kind of move around and then they feel afraid. And so, we need to help calm them down. And oxygen a lot of the time will really help that. Confusion. So restlessness and confusion are hand in hand. Like, where am I? What's going on? Why is this happening? Pale, cool, clammy skin. Nausea. They feel sick, like they're going to throw up. A rapid or weak pulse, or rapid or shallow breathing. If it is believed someone is in shock, the following steps should be taken. The patient should be laying down on his or her back. So you want to lie him back on the ground. You can, and again, this is for staff to do, but you can assist. You can help. Just calm them down. Say, hey, everything's all right. Let's make sure we're listening to our staff. The patient should be warmed by placing a blanket over him or her. We could also use coats depending on what we have. If there's not a blanket available, we do have an emergency blanket in our van. So this is why it's good for you to help with the emergency checklist. So if I need it, I could say, hey, here's the key. Please go grab that blanket. The patient's airway needs to be checked to ensure it is unobstructed, so there's nothing in there. Again, this is for staff. Oxygen then needs to be administered. So, again, this could be mouth to mouth, but, if we're on site, which is what we're kind of going over, then, we'll talk about it a little bit later. The steps above would also hold true for someone experiencing heat stroke. But rather than warming the individual, he or she should be moved to a cool environment and clothing removed. Someone having difficulty breathing will probably be most comfortable sitting and then having oxygen administered. So have them lie until somebody gets there with something, and then maybe help them up so that they can have it, sitting up, which again, just kind of, it will go through the airway a lot better than if you're lying on your back. So every Contra Costa Vistability program or campus has an oxygen unit on site that is routinely serviced. It holds about 88 minutes of oxygen, sufficient until professional assistants arrive. Your safety coordinator, which is Spring, can demonstrate for you how to use the oxygen unit. So one thing is that we're mostly off-site. But there are other programs that are on-site. And the programs that are on site, if you see any individual from any other program and you can say, hey, I've gone over this safety training. They're exhibiting these signs. They're having difficulty breathing. They're either breathing too fast or too slow. You want to get the program coordinator or staff there and know that, sometimes you might be of great help to know where the oxygen unit is. And it is in Nancy's program. So if somebody was really having difficulty breathing and they needed help, and say they were outside kind of on the walkway or anything like that, or in the after school program or anything like that, and a staff says, hey, can you do me a favor? I need you to get the oxygen unit. You go over and you ask a staff at Nancy's program, I need an oxygen unit. Somebody's having difficulty breathing. And then every staff is trained on how to use it. And it's really quite easy. You put the mask over their face, and there's basically just an on button. And then we'll be calling 911 because it is a medical emergency. Okay, so now we'll go over administering oxygen. And this is the type of machine that we have. If you can see these pictures, I'm going to hold it up for a bit. But this is the one that we have. And it says, always follow the standard precautions when providing care. Follow local protocols for using emergency oxygen. But this is a lot. We make sure that everything is in use. So, number one, when you're administering oxygen, if you had to do it for some reason, this is good to know. Number one, turn the unit on and adjust the flow as necessary. The flow on ours, I think it's pretty much set at 1. I mean, you can turn it up a bit, but it's pretty much set on what anybody needs to really breathe. And there's nasal cannula, which is the first kind, and so that person would only need 1 to 6 LPMs, which is something per minute. I'm going to find out what that is, because I have all the information right here, but I don't want to go on. Oh, liters per minute. And that's usually like asthma and things like that. So then, you would want to do 1 to 6 liters per minute. The second one is resuscitation mask, would be 6 to 15 liters per minute, which is more because you're trying to resuscitate the person. And a non-breather mask would be 10 to 15 liters per minute, so pretty much at its maximum. And you want to inflate the oxygen reservoir bag by 2/3 by placing your thumb over the valve, and then there's also BVM, which is Oh, valve mask resuscitators. So, and then you want to verify the oxygen flow. You want to listen for a hissing sound and feel for oxygen flow through the delivery service. Place a delivery device on the victim and provide care as needed. And what you want to do, staff would show you there. Your job is to go get it. The staff's job is to make sure we administer it correctly. But you just put it over their head, kind of under their chin, have the mask firmly in place over their nose and their mouth, the way we're supposed to be wearing masks right now. But you want to make sure that oxygen flow through the nose, which is getting into the brain, down through the mouth, which is getting into the lungs. Okay, now we're going to go over a review. Let's see if we can get all of these right. Okay, a person having difficulty breathing will not experience any difficulty with his or her speech. So after what we went over, is that true or false? Because all of these are true or false. And the answer is false. They would have difficulty speaking. Again, they get restless and they use short sentences as opposed to speaking the way they typically do. Number 2, emergency oxygen can be administered to a person having an asthma attack even after using an inhaler. True or false? The answer is true. Because sometimes the inhaler doesn't do the job. Oxygen can do a much better job in some situations. Number 3, symptoms indicating a person might be experiencing shock include rapid breathing, strong pulse, and cool, clammy skin. The answer is false. When it comes to shock, they probably have more of a weak pulse than a strong pulse. And yeah, and breathing is different, so it's not, it's not 100% true. So let's go over shock. So they would have rapid or a weak pulse. And rapid and or shallow breathing. But they would have pale, cool, clammy skin. So somebody going into shock, the symptoms vary, is basically what it's saying. Don't say it's like, oh, you're in shock because of this, or you're not in shock because of this. You really need to look at, everything that we've gone over and make sure that we know exactly. So it could be rapid or shallow breathing and a strong or weak pulse, including cool, clammy skin. Okay, number 4, if administering oxygen to a person experiencing respiratory distress, symptoms improve, it is not necessary to call 911. And the answer is true or false? False. It's always best to call 911. We want to make sure that the person's 100% better. I would want the same for all of you. And you alright, girl? And I would want the same for myself. Make sure that, I'm okay and that you're all okay. Number 5, using shoulder and back muscles to assist with breathing, and pale or bluish skin and lips can be considered signs of a person experiencing a lack of oxygen. What's the answer? True or false? The The answer is true. Again, trying to straighten out that airway. Number 6, for a person diagnosed with diabetes, administering oxygen to the individual when he or she is showing signs of low blood sugar, confusion, irritability is a recommended response. The answer to that is false. What you would want to do if somebody does have diabetes and you know about it and they have like a diabetic bracelet on, if they're going into, if they're showing signs of low blood sugar, what they need is a little bit of sugar, but good sugar, like some orange juice, something that would help kind of quickly with that. Maybe a little bit of food, something like that. But they don't need oxygen. That's not going to help. It's a whole other ball game. Number 7, medical conditions for which oxygen administration is recommended include COPD, bronchitis, and pneumonia. True or false? It is true. Number 8, if someone has lost a large volume of fluids due to an injury, oxygen should be administered to help prevent the person from going into shock. Is that true or false? Okay, the answer is true. And number 9, after performing CPR on a person, oxygen should never be administered to that person. True or false? Kind of goes back to another one that we already had, but it is false. Again, we want people to be as safe as possible, and some oxygen could really do them good, especially after having CPR. If you're doing CPR, the ambulance shows up, what are the main things that they do? They get the person kind of back to going where they need to be, and then they provide oxygen. Bonus question. Oxygen should not be stored in a location that will experience high temperatures. True or false? And the answer is true, because oxygen can, those tanks, they can explode if exposed to too high a temperature. Okay, so, this is good to know. I want to know the questions that you have. I'm also going to, for the second part of our class today, I'm going to send out a YouTube video that goes along with this so that you all can see exactly what to do. And so it's a lot more visual, than what I've done here. But anyway, I miss you all. Go Jazz. And go all of you. Go do great things. And stay safe, though. Mask it up. And be good to you and yourselves and your friends. Okay. Bye for now.